Hello to all Eldercare team members. These are challenging times, and I want you to know that the board, executive team and I are very aware of the concerns that many of you have in relation to COVID-19. There are a lot of mixed messages out there that are causing people to panic, and I want to reassure you that we are staying across all of the latest official advice to protect your health and the health of our residents, who are our number one priority. The spread of this virus in Australia has been well contained so far, and its effect on young, healthy people is mild, but it can be devastating for older people, even resulting in death. So, we must do everything possible to keep the virus from getting into Eldercare's facilities. The advice from the Australian Government continues to evolve in response to the changing situation. I've been sending out regular emails to staff, residents and their key contacts, our volunteers and contractors, to let everyone know what we're doing in response to this pandemic. It is important that you read these emails to make sure you understand the latest requirements. Things are changing quickly, so there will be ongoing communication from me. However, you should continue to apply standard infection control procedures, which include washing your hands frequently with soap and water before and after eating and after going to the toilet and after attending to a resident. Use hand sanitizer when washing your hands isn't practical. Cover your coughs and sneezes. Cough into a tissue or your elbow, dispose of the tissues and wash your hands. Practice social distancing. This means where possible, avoid direct contact, such as shaking hands and keeping a distance of 1.5 metres between yourself and others. Of course, your work often requires you to be much closer to residents than 1.5 metres, so use your best judgment. Don't come to work if you're sick. Don't come to work if you have recently returned from overseas. Don't come to work if you've been in contact with somebody who is a confirmed case of coronavirus. And comply with the self-isolation instructions being issued by the Australian Government. These measures apply in your personal life as well as your work. And I can't stress enough how important it is that you follow these instructions. You should also be using PPE responsibly. Excessive use at this point is irresponsible and counterproductive. It creates unnecessary anxiety amongst fellow staff and residents and means that our suppliers could be affected in the case of an actual outbreak. And you must continue to comply with Eldercare's privacy policy, meaning that you should not discuss the health of any of our residents other than where it is required to support their care. Eldercare is also taking additional steps to protect the health of our residents. Instructions will continue to change as the government issues new advice, but the central aim is to reduce the potential for residents to be exposed to the virus. At this stage, this includes instructing family and friends of residents to reduce their visits. All visits to residents will now be restricted to essential visits only for up to 15 minutes once a day. Up to 2 people can attend during this one visit. That is, up to 2 people for one visit, up to 15 minutes per day. This does not mean that the residents can have multiple lots of visits of up to 15 minutes each time. Visits must be in the resident's room or outdoors, and we are not permitting children under 16 to enter Eldercare sites. We have cancelled all resident lifestyle activities that involve external suppliers, and we have cancelled all resident outings. We are actively discouraging residents from going on outings alone or with family or friends. The use of volunteers and new student placements has been discontinued, and we are cancelling resident and family meetings. Visits from doctors and allied health professionals will continue, and the hairdressing salons will also continue, but only for Eldercare residents and clients. Gym activities will also be continuing for the time being, but we will be limiting the number of people in attendance and screening those who attend and employing social distancing. And external visits by faith-based groups are also ceasing until further notice. I understand that these and potential future measures will impact on our residents, We'll do our best to manage their expectations and to support you to provide in-house activities and alternatives where possible. I also realise that staff are affected in this situation and want to assure you that the leadership team and I are very mindful of this. The measures that we are taking have been carefully considered and designed to ensure that staff are treated fairly and equitably. The email that I sent to you on March the 17th explained how we're dealing with issues such as annual leave, rostering and childcare responsibilities. Some of the key points you need to know. You are required to attend work as per your usual roster, unless you are sick, have approved leave or are required to self-isolate. You are required to follow the directions of your supervisor with regard to the areas you are allocated to work in and the residents you are assigned to care for. New requests for annual leave will be reviewed on a case-by-case basis and only approved in extenuating circumstances. Previously approved leave will be honoured. If you have cancelled your annual leave because of the current restrictions, you can pick shifts back up, but you cannot take shifts away from non-agency staff already booked to cover your annual leave. If you need to care for a child who is not able to attend school because the school is closed, you can use annual leave, long service leave, or take leave without pay. During this time, you'll be allowed to access up to 2 weeks annual leave in advance if all of your annual leave entitlements have been used. At this time, there are very clear conditions for when a COVID-19 pathology test can be taken. If you're feeling unwell, but you have not travelled overseas and have not been in contact with a confirmed case, you will not be eligible for a test, but you must not come to work. If you feel unwell at work, then you must leave immediately. Call your GP for advice, as you may need an appointment. You must stay at home and, where possible, avoid contact with others until you are better. You cannot return to work until you are better. If you are feeling sick with fever, cough, sore throat, shortness of breath or fatigue, and you have been in close contact with a confirmed case of COVID-19, immediately self-isolate and call your GP to book an assessment and testing. Ensure you provide your symptoms and travel history over the phone when making the appointment. Your GP may offer to see you while you're in your car instead of inside the clinic. If your GP is unable to assist you, visit a COVID-19 clinic. You must remain in self-isolation until you receive a negative test or for 14 days from the date of your last exposure with a confirmed case of COVID-19, whichever is longer. If you are required to self-isolate as a result of travel which took place before the government measures that took effect on Sunday the 15th of March, you will be paid for your normal rostered shifts. This will be special leave. You won't be required to use other leave. If an outbreak does occur, we are prepared. We have stocked outbreak kits at all of our sites, and we have a staffing contingency plan in place which will be activated if needed. If this happens, we will immediately let you know how you can assist. If an outbreak does occur, we do need everyone who is well to come to work. We need your cooperation and support to ensure that our facilities remain safe and virus-free. We'll be supporting you with extra training and rolling out our annual flu vaccination program commencing on March the 23rd. It's very important for you to be vaccinated against influenza this year. The government has announced that people will not be able to enter a residential aged care facility after the 1st of May if they are not vaccinated against the seasonal flu. So we have arranged for all of our staff vaccination sessions to occur prior to this cut-off date. It will now be compulsory for all staff to be vaccinated for the seasonal influenza. We are waiting for guidelines from the Department of Health on how we will manage staff who refuse or who are medically unable to be vaccinated. We are also working through the HR implications for how we will manage those staff members who are not vaccinated by the 1st of May. I know this is a really stressful time for everyone, so I remind you that our Employee Assistance Program is available to you and your immediate family through access programs. You can pick up a brochure in your staff room or speak to your supervisor for more information. Because you are working with people who are particularly vulnerable to the effects of this virus, you must take these instructions very seriously. Again, please be assured that we are doing everything possible to make sure that you are safe and that you are able to keep our residents safe. If you have questions, please speak to your supervisor or site manager. If they are unable to answer, they will let you know who you should speak to next. Thank you again for your cooperation. I really appreciate your support in keeping each other and our residents safe.